It was 26th December 2004, a black Sunday for Asia, as thousands of precious human lives were washed away to death. The Indian Ocean earthquake triggered deadly tsunami, a series of killer waves that were generated by a very severe earthquake which struck Sumatra off the northwest coast of Indonesian island. The killer waves lashed the coastal areas of the Indian Ocean, affecting Tamil Nadu, Pondicherry, Kerala, Andhra Pradesh and Andaman Islands in India. The single massive tidal wave snuffed out several lives in a flicker, leaving many dead and homeless. In India, a deceptive calm hung over the entire coastal region. Huts were torn apart and their remains strewn around. Even the newly built concrete houses have been reduced to rubble. The coastal areas were littered with kitchenware, cloths, footwear and fishing gears. As normally it is the fisherfolk who inhabit the first few hundred meters of the sea, they were the main victims of tsunami and bore the brunt of this tragedy.
இந்த சுனாமி ஏற்பட்டதிலிருந்து இதுவரை 3 மாத காலமாகிறது. எங்களுடைய தொழில் நாங்கள் ஒவ்வொரு நாளும் சிறுதலைக்காடு கிராமத்தில் கிட்டத்தட்ட 380-400 பேர் மீனவர் தொழில் பண்ணி கொண்டு இருக்கிறோம். எங்களுக்கு வேற எந்த தொழிலுமே தெரியாது. மீனவர் தொழிலை நம்பிதான் நாங்கள் உயிர் வாழ்ந்து கொண்டிருந்தோம். இயல்பிலே நாங்கள் எப்பவும் போல் தொழிலுக்கு சென்றிருந்தோம். செல்லங்கன்னியாத்துக்கு பக்கத்தில் நாங்கள் எப்பவும் வழக்கம் போல் தொழில் பண்ணி கொண்டிருந்தோம். காலையில் 8 மணிக்கு தான் இந்த அலை வருவது எங்களுக்கு வரும் என்று தெரியவில்லை. கடல் கொந்தளிப்பு எப்பவும் இயல்பு போல் இருந்தது. அதனால் நாங்கள் மிகவும் எப்பவும் போல் இப்படிதான் இருக்கும் என்று இருந்துவிட்டோம். அதனால் எங்களுடைய முதல்களெல்லாம் கடல் அடித்து கடலுக்கு கொண்டு போய் எங்களுக்கு எந்த விதமான ஒரு மீன்பிடி தொழில் பண்ணுறதுக்கு உள்ள ஆவணங்கள் எதுவுமே எங்கள் கையில் இப்போ தற்சமயம் இல்லாத நிலையில் நாங்கள் எந்த தொழிலுக்கும் போக முடியாத நிலையில் ஊரில் சும்மா வசித்து கொண்டிருக்கிறோம்.
Having lived close to their place of work all these years, they now realize that their survival may depend on the changing moods of the sea. Generally, to be old is to be overlooked in the relief distribution programs. But it was HelpAge India, the very first organization which initiated help to the affected elderly people. HelpAge India identified them with the help of the NGO partner agencies and reached them with relief support. The elders were also given health education through a puppet show.
அத்தோடு இந்த தினம் இந்த முதியோர்களுக்கு இப்படிப்பட்ட ஒரு திட்டம் நடத்துகிறோம் என்று உள்ளாட்சி மன்ற முதியோருக்காக இன்னொரு தொண்டு ஹெல்பேஜ் இந்தியாவோட சிறப்பானது வேளாண்மை பாதிப்பு இன்னொரு தொண்டு அப்படி நீங்க பண்ணும் பொழுது நம்மளோட உதவிகள் முழுமையை அடைகிறது. எங்களுக்கு இருக்கிற சில யாராலும் அதிகாரியோ இல்ல உள்ளாட்சி அமைப்போ இல்ல தொண்டு நிறுவனமோ இந்த மாதிரி இழப்பிருக்கணும் யாருமே
In all the 3 phases of distribution, the beneficiaries were identified, given special tokens. On submission of the tokens, the respective beneficiaries received their packages from the distribution team. During distribution, the elders were accompanied by one family member each, were seated and duly respected. Helpage India conducted even medical camps for the elderly affected.
This camp is organized by Helpage India along with some organization over here. We are from ABC Hospital, Tsunami. We have come to attend this geriatric camp. Mainly this camp is focused to over age of 60 years. Mostly they are having a problem of hypertension and osteoporosis and diabetes mellitus. And we have started giving the advice and other medications over here. Our patients are getting, they are more satisfied because they come from long distance to take care of the need of the people over 60s. They are quite satisfied, madam. Okay. Being the director of Community Action Rural Development Valangani, we have launched today a program through the help of Helpage India, Chennai, and we have given relief materials to the old age people. There is about 1,000 people who collected the applications, but we have given only 450, 500 applications. We are going to distribute the relief materials today and day after tomorrow as a whole. It's a very useful program for the old age people. It's a really wonderful collector today appreciated the relief material given to the old people, and he has passed so many orders to the RI and government people to release the old age package to the really affected old age people here in Velangani at the tsunami attack.
நல்லா உட்கார வச்சு நல்லா சந்தோஷமாக எல்லாருக்கும் மரியாதை பண்ணாவோ நல்ல விதமாக செய்து விட்டாங்க எங்களுக்கு. நல்லா இருக்கிறோம். எங்களுக்கு எல்லாம் சேதமாக கூப்பிட்டு போனாலும் இப்போ நிம்மதியாக இருக்குது எங்களுக்கு. அவ்வளோதான்.
There was a press meet
கோயிலான் சோஷியல் சர்வீஸ் சொசைட்டின்னு ஒரு
Rajathurai,
நிறுவனம் இருக்கு.
Director,
கோயிலான் சோஷியல்
Southern
சர்வீஸ்
Region.
அவங்க மூலமா அங்க பாதிக்கப்பட்ட மக்களுக்கு இதே மாதிரி சிறு கடைகள் வைக்கிறதுக்கு போட் நெட் இதெல்லாம். I am speaking from Sirudalai Kadu and Sakkaraipettai, which is quite far from Nagapattinam. Place called the Vedaranyam is close by. It is in these two villages. Nobody has come and given them any relief work. And the organization Bharati Women Development Center, situated at Nagapattinam, who is one of our NGO partner for quite some time, has selected this area, and today we are giving relief operations materials worth of rupees 2,400 for about 500 elders in these two villages. Materials like mat, buckets, mugs, and then some clothings, utensils, 50 kg rice, other provisions, and then slippers, and all the items that is required for them is given today. The old people are very happy, and they felt so happy that nobody has come to this place to give them any relief work, and Helpage India, with the help of Bharati Women Development Center, could able to bring some smile on their faces. Some of them didn't have food for many days and they are really starving. Definitely the rice that we have given them will not only bring happiness to them but will bring happiness to their family members. We also had discussion with the elders groups, especially the men groups here. Mr. Nagarajan and myself, we had a long discussion with them. We are also planning to form 5 self-help groups of men in this particular village, and we are very confident the quality of life of these fishermen in these two places, Sirudalai Kadu and Sakkaraipettai, will definitely come back to their original, not only original, better livelihood than what they were before.
அதான் எங்களுக்கு ஒன்றும் செய்யலையே ஒன்றும். நாங்கள்லாம் இதை இன்னுக்கிட்டு வாங்கிட்டு தான் இது பண்ணோங்க. இந்த அரிசி முட்டை வந்தது, அது வந்து ஆளில் அப்படியே அரப்பி கொடுத்தாவும். அதான் எங்களுக்கு நாங்கள் நேற்று முந்தாரி சாப்பிட்டோங்க. நேற்று அடித்து செவனியான்னு இருக்கிறோங்க. எங்களுக்கெல்லாம் யாருக்கும் ஒத்துருங்க மனுஷன் இது இல்லை. எங்களுக்கு நீங்கள் கொடுத்தியே ரொம்ப சந்தோஷமாக இருக்கும். நல்லா நிறையா கலந்து செய்யுங்க எங்களுக்கு. சொத்து எல்லாத்தையும் தான் அள்ளிட்டு போயிட்டேன். நாங்கள் பழத்தே தப்பு.
The Tsunami Project Office is based in Cuddalore with an efficient operational team.
The Tsunami Project Management Office in Cuddalore was exclusively initiated and started for implementing the tsunami affected, giving life to the tsunami affected elders and their families. It was formally inaugurated by Mr. Todd Peterson, the Chief Executive of Helpage International, on 8th February. And then now we have initiated the full-fledged office here in Cuddalore, which is going to monitor the rehabilitation program from Chennai to Koilan. We have identified project partners for carrying out this rehabilitation project in all the areas. The main idea behind the whole project is providing a livelihood support to the elders and their families, those who are very badly affected by the tsunami. It is not only providing them livelihood, we are also planning to support the elders in a different ways. We also thought of helping elders by giving a monthly pension of ₹500, and we also thought of building some houses exclusively for elderly persons.
I am the financial advisor for the Tsunami project. I am officially employed by HelpAge International and for an initial term of 6 months. In that time I am going to oversee and help in the setting up of the financial systems, both for HelpAge India in the Cuddalore office and for the partner agencies. A big part of my role is not just to oversee this, but is also to institutionally strengthen both HelpAge International and the partner agencies.
My name is Prabhat Kumar. I have been appointed as a technical advisor to the Tsunami program. My main mandate is to backstop and provide necessary support to the program which has been designed in order to address the rehabilitation needs of the people who have been affected by the tsunami victims.
HelpAge India feels satisfied with all the 3 relief distributions and medical services provided for the elderly affected victims of tsunami. To enable the affected elderly to overcome the burden of the tsunami tragedy and to provide them with a platform infrastructure for their future is the main challenge before HelpAge India.